I'm going to speak about data science in biophysics for applications in drug discovery, and of course I'm going to mention also the AI component. So this is going to be more of a technical talk regarding biophysics and how we can use it in precision medicine. So we'll start with precision medicine and explaining what's the connection of biophysics and precision medicine. And then I will move on to biophysics data sources, how we can utilize this data for artificial intelligence, and in turn, how we can use data science, artificial intelligence in biophysics for drug discovery, which is the important thing for humans. And then I will mention an application from our lab, a specific application on how we use artificial intelligence to predict protein membrane interactions, and I will explain why that's important. And I will close with the applications in drug discovery and some concluding remarks. So what is precision medicine? So basically this concept of precision medicine, which is quite new, it's here just for the last 15-20 years, is the ability to offer the right drug to the right patient for the right disease at the right time and at the right dosage. So we want to give patients the best possible medicines. And genetic and metabolic data now allow these drugs to be specifically tailored for specific patient groups. And I will give you a specific example why that's important. An example, for example, in chemotherapy. Before, all cancers were just treated with cisplatin, so one dose and one medicine would treat all cancers. But we now know that that's not the case. Essentially, the tumors have their own DNA. They have mutations that cause the tumor genesis. And the specific tumor profile of the specific patient and with a specific cancer is very different from others. So we want to give patients specific treatments. And not only that, also in the dosage. So before we would give one dose for all people. Some people would respond to a normal dose. Some people would respond to a lower dose or higher dose. And some, as mentioned, would respond to completely different medications. So for example, structures than what we had previously. So we could use this deep learning approach for these two different data sets. We constructed the embeddings. This is the final data set, labeling amino acids as membrane penetrating and non-membrane penetrating, splitting again the data set, and finally training and the results. So the results of the protein language model applied to protein membrane amino acid prediction was very good. So we could actually predict with high accuracy and just in seconds. This is in seconds instead of minutes that DREAM took. The same essentially predictions with DREAM. So it was quite successful. But the only limitation here is that if your data set does not, because the data set that we had was for 9 protein families, if we gave it a different protein family, then it didn't predict anything. So to conclude, this is my final slide. AI and ML needs big data. In this case, for example, with a natural language processing, we didn't have data for all protein families. We only had for 9 protein families. And so data needs to be of high quality and correctly annotated and unbiased. Otherwise, you're not going to get any result. You're going to do overfitting for this, for example, 9 protein families. AI cannot predict a property if it's not in the training set. If the AI has not seen it, it cannot predict it. Like, for example, of AlphaFold, if it doesn't have the information about the membrane, it cannot predict it. So it's useful because it can give you correlations of data that you cannot predict with a human eye. But if it's not in the training set, you cannot really predict it. So molecular simulations and these physics-based methods that I showed you in the beginning are of value because they provide these physical insights. And AI and these physics-based methods are complementary and can be used in tandem. And we also have a special issue on machine learning in biochemoinformatics in the Journal of Chemical Information and Modeling. And I would like to close with acknowledgements of the group, of the funding, of you for your attention, and the organizers for the kind invitation.